And with all of that in mind, health officials are warning all of you to be as safe as you can as you celebrate this Halloween weekend. Brooke Katz in studio with some precautions that doctors say you may want to think about taking. Brooke?
And Doug, yes, it is important to have some fun, and we all need it right now, but doctors say just a few steps can really lower your risk of exposure.
We don't recommend the traditional trick-or-treating, but, doing things, if you can do virtually, there's a lot of ideas, virtual costume contests, watching a scary movie.
With COVID cases rising, the Health and Human Services Director for Dallas County says celebrating with your family in your own household is best. The CDC echoing that, recently breaking down activities by risk level. When it comes to moderate risk activities, think creative ideas like one-way trick-or-treating, grab-and-go style to cut down on crowding and interaction.
You don't have to go and sanitize every little bit of candy and things like that. It's okay.
Dr. Min Nee, an internist with Texas Health Southwest Fort Worth, says you don't need to worry about the candy wrappers, but he says you should take care to social distance, especially if you're someone who's at a higher risk. He says parents are more of a concern than the kids.
If you're in that age group and like me, you're an older parent, then, take a little bit of extra precautions.
Dr. Nee suggests sticking with a known neighborhood with your own pot of friends you've been around. And no matter what you choose, health officials stand by the advice we've all become so familiar with.
Everyone should be wearing a mask. Everyone should be keeping at least 6 feet apart. They should be avoiding crowds. They should be washing their hands, using the hand sanitizer.
So among the high-risk activities, traditional trick-or-treating, indoor parties, or haunted houses where people are crowded together, Doug, those are not recommended.
Hard this year, but good advice.